So tell us about yourself.
Okay, let me introduce myself a bit. I'm a 56-year-old plastic surgeon based in Istanbul, and for the last maybe 15, 20 years, I'm only doing hair transplantation. Of course, I used to do lots of trauma surgeries, aesthetic surgeries, but nowadays, at maybe last 10, 15, only hair transplantation. And I love to do hair transplantation, and actually I don't have any more time to do anything other than hair transplantation. You said you should say no, otherwise nobody will trust your yes. Sometimes we should do that because we are doing this same operation every day, hair transplantation, for the last 20 years. I am an expert on hair transplantation, but this doesn't mean that everybody will be always happy. You should set up all the expectations in the beginning very well. You do the same job, you get the same results, standard results, but if the expectation is not, set, then patients can be unhappy, because with a very weak donor site, with a huge hair loss area, you cannot do a whole coverage. You cannot give the original density. Maybe you can improve the appearance. Maybe you can improve the self-confidence of the patient, but patients must be prepared for it also. Otherwise, you should choose your patients wisely, and sometimes you should say no, because you know that they will.
This is a good question. How do you choose your patients?
First of all, there's a donor reserve, the area between the ears on the back and hairless area. We should compare it. If the donor reserve is enough to do any hair transplant, to do hair transplantation. Because if you have normal 6, 7 hair loss, this means you cannot get one-time coverage with a good density in one session.
Why
it is
not?
For sure, because
your
your donor site is smaller than your hair loss area. If I get all the hairs from the back and then transplant on top, it will be very short. We are in these cases, of course, we are improving the appearance, but we are trying to give an illusion of hair, not a full density in these patients. And patient must know it. Mostly they understand and they accept, but sometimes they have really high expectations. And in these cases, you should be very careful. You should be honest. You should be very, sometimes conservative and obsessive about the plans.
Are there any patients that are Norwood 7 that you did hair transplant and did it made it like it was good one?
In Norwood 6, 7 patients, of course I do hair transplants, but mostly I advise combined operations for these patients, because you should get more to cover more. To get more grafts from the donor side, to increase the yield, I am doing FUT plus FU operations, but mostly not in Israeli patients, because Israeli patients are not keen on having FUT. I don't know why, but this is like that. And when I advise them FUT, they don't want to do it.
Why is it good to have FUT, in your opinion?
I think in Israeli cases, they have some bad experience about FUT. And it's really difficult to tell them that FUT is not a bad option. Sometimes it is the best one. And mostly, even in US and UK clinics, it's already been done. They are using FUT.
I think what scares
it's out of question.
Yeah,
in
but
Israel.
I think what scares the Israeli patients is the big scar.
Yeah, scar. For my cases, actually, the scar is not an issue. It is really very thin white line, and if you use your hair number 2, 3, it's always covered, and nobody will see the scar. Scar will not be an issue in their life. But on the other hand, Israeli patients want to use their hair very short, even if they have hair transplantation. And if they really use very short, if they wear short hair, then this scar is visible. And it's not a good option then.
What about when you're doing FUE? Do you see the scar underneath?
There will be always scars. If you cut anywhere in a body, there will be scars. If you say it will be a scarless technique, then it's really misleading. Scarless is a very misleading word in hair transplant business.
Yeah, for sure.
There will be some scars, but in FUE, there will be scars like white dots, hypopigmented white dots, and they will not be visible if you don't shave totally. If you shave, of course, 0, it will be visible on the donor side. But, if you have any hair, it will not be very visible, and nobody will notice that you have some scars on back.
I think that a professional doctor will know how to take the right amount of graft from the donor area and not to take more than you can have in order for the small scars to be not visible.
Scars will not be visible, of course, if you don't get more than you need. But on the other hand, it's a donor reserve and it's not infinite.
Yeah.
For example, in an average patient, donor reserve is around 6,000 to 8,000 grafts. Maybe it can be a bit more or a bit less according to the density, hair quality, but generally it's 6,000 to 8,000, and you can use this 6,000 to 8,000 reserve in 2 or 3 sessions maximum.
So you're telling me the maximum amount of grafts
in a lifetime
is 8,000.
Is 8,000 maximum, and it can be harvested in 2-3 sessions.
Yeah.
And it is really surprising that some clinics around the world are advising 5,000-6,000 grafts in one session. It's not realistic. Nobody is doing.
Yeah.
And if you try to do these 5,000-6,000 grafts, then you will ruin the donor side. You cannot get that much
grafts.
In my clinic, the maximum amount will be always 3,500-600 grafts in one session.
Mm-hmm.
If you need more, then it will be done in the second session, maybe in the third session.
How much time do we need to wait between the first and the second one?
At least 1 year.
At least
because you'll be getting the result in 1 year. Yeah. When you do a surgery, in the first 3 months, it's a very silent period. You don't expect anything. Your appearance will not change. No extra density, nothing. But after 3 months, there will be a gradual increase in your density, and we can say that 10% increase per month.
Mm-hmm.
And after 12-14 months, we will say that this is the final result, final outcome. Yeah. Then we can make a real comment on it. I cannot make a realistic comment on the 3rd, 4th month after operation, because I don't know how it will progress.
Mm-hmm. What do you think about the crown area?
One more thing that I'm having some problems sometimes with the patients, because medications are very important in the first year.
Yeah.
In terms of pills, Propecia, Rogaine, and PRP injections, they help a lot. They are not just for hair loss prevention. After the operation, in the first year, they have some beneficial effects on the operational results, operational outcome. They are supposed to get more stronger results with the help of these medications.
Yeah.
But of course, every medication has some burden, some side effects and risks, but it's life. If you want more hair on top, it is worth to take the risk and try it, because the risk is not that much high, like written on internet.
Yeah, but we can
It's
take
around,
the...
it's around 1-2%, and mostly psychological.
Yeah. Can we take the Proficia or Rogaine for 1 year?
If you take it for 1 year, at least 1 year, it's very beneficial, useful for the operational outcome.
What happens
After
if we
1
stop?
year? After 1 year, you'll be using it for hair loss prevention. Maybe you can quit. You don't need it. But in the first year, if you have any operation, then it will be really a wise option to use.
Yeah. This is the first time I hear about that, so it's very interesting that you ask your patients to use Proficia or Rogaine. Some of the doctors doesn't recommend it at all, Rogaine, for example. So it's very nice to hear that. I believe in using Rogaine because I think it's doing a good job. It takes the blood to the head and it makes the hair thicker. It helps. I heard that it helps the donor area to recover. So because of
at the end, Rogaine and Propecia are the two most used medications, and they are FDA approved.
Yeah.
You know, they are gold standard for hair loss prevention and treatment.
Yeah.
But of course, it's a kind of risk. Even you get a painkiller, you can have some serious, sometimes life-threatening side effects from painkillers.
Mm-hmm.
But this doesn't mean that you'll not use painkillers.
Yeah. So one of the most common question we had from the group is what happens if you stop? For example, you stop Rogaine. Is it dangerous? What will happen to your hair?
Look, there's a real story about it. It's like an umbrella under rain. Okay? You should have protected from rain. You know, if it is raining on top, then if you open your umbrella, you get protected.
Yeah.
Okay? For a while, how long you use it. And then if you close your umbrella, the effect is over there. It's continue raining, and then you will get wet, of course. This doesn't mean that Rogaine or Propecia has some bad effects after they stop.
It doesn't mean that they have like
when you stop using it, you are stopping to benefit also.
It doesn't mean that it will get worse than if you wouldn't have used it.
You just close your umbrella under rain and then you get wet again.
I like it. I like the way I talk about it like going to the gym. Once you stop, your muscles disappear.
Sure.
Yeah, that's how I talk about that.
Continuous using and regular using and to be consistent about it is very important.
Yeah. So tell me about something about the Israeli patients. What is the most common question Israeli patients ask about hair transplant?
Actually, all hair transplant patients are first asking the same thing. Will it be natural? Will it be a full coverage? Will it be a good density? Does it work to do it?
So what is your answer for that?
The only answer that I can answer is it will look natural and aesthetic, because this is my job, how to do it natural and aesthetic. Yeah. Because if you do a good hairline, if you choose good grafts, if you preserve them when you are extracting, this is your job. But will it be a full coverage? Will it be a good density? You know, according to me, it's a good density, but I don't know if the patient's in mind, is it a good thing also?
Yeah.
You know, expectation is very important at that point. You can never get an original density in one session. This is for sure, because we are not transplanting that much.
Actually, it's very important to talk about hair transplant because hair transplant is an illusion. You don't grow new hair, right? It's some kind of an illusion. You reorder your hairs in a nice way, so when it grows, it will look full or whatever it can happen for this patient.
You can be very close to the original density, but not in one session.
Yeah.
Maybe with upcoming sessions, you can move to an original density in a certain area. But generally talking, the density on donor sides in an average patient is 70 grafts per centimeter square. 70.
70, yeah.
And our goal is always putting around 35 grafts. If you put at least 50% of your original density, you can get an improvement and you can get a real change when you look at the mirror. That's why this is the goal, 50%.
It
not
makes
the
people
original
with
density.
they're much more confidence in themselves, like it happened to me. You wouldn't have know who I am before I did the hair transplant, and it really changed my life. So I talk about hair transplant, and I suggest people to do it if they can. It's very important for your life. It made me happy. So you're some kind of like a magician. You help people to make them very happy. So it's a good job, I think. It's a good job.
It is really working, yeah. It's changing life, changing confidence, changing your appearance. You know, it's the hairline, and especially frontal hair is the frame of our faces.
Yeah.
If it is missing, people are looking at this missing part mostly.
Yeah.
And they are not looking at your face. This is the way of nature. You first look at the missing part. But if you have any defined hairline, it doesn't matter if it is high, if it is very dense or not. It doesn't matter. If you have a defined hairline, this means you have a frame on top.
Yeah.
And then people begin to look at your face again.
Yeah.
And if they look at your face, they didn't notice on top anymore.
What
they
do you
don't
think
judge
about
if
hair transplant in the crown area? Because when you look at a person, you see the front line, but what about the back?
Of course, it's also very important. But in the first place, we always do hairline and the frontal part. This is the most important part that we should do.
Yeah.
For example, I don't accept if they say the patients are asking for crown transplantation without doing frontal parts.
Yeah.
It will look weird as a patch. But if you do the front first, then you can do the crown.
Can we do a full coverage here?
If you have a Norwood 6, of course, including the crown with full coverage is impossible in one session.
Yeah.
But if you have a hairline, receding hairline, and good density on top, in between, and then crown, of course, we can do the crown and the front together.
Yeah. So one of the biggest questions in our group is when doing a hair transplant, is it for, let's say, for a lifetime?
For sure, yeah. Otherwise, it doesn't make sense to do hair transplantation. If we transplant these follicles and then if they fall off in 2-3 years, why we are doing this?
No, but I mean like in a long...
This area, you know, the donor side is resistance to DHT. They don't, these follicles don't have DHT receptors.
Yeah.
And they are free of DHT effect. That's why when you get them from donor side and transplant on top, they behave the same. They are DHT free and they will never fall off.
What about aging?
Of course, with aging also. You know, this part is always there. The most stable and constant part. But of course, with aging, hair will grow more slower, getting thinner, and the density will look a bit less, even if they don't fall off. Well, it's also natural in aging also.
Yeah. So someone from the groups asked about something that is, maybe you can answer it. So how does the hair transplant process affect hair bleaching? for better, worse, or there is no connection between them?
I couldn't understand.
Like when you
If you do hair bleaching after the hair transplant.
What? Sorry?
Are you asking this? Like, can we do hair bleaching?
No. She asked if there's a connection between doing a hair transplant and the hairs goes gray. Like, is this affecting of the hairs becoming more gray after doing a hair transplant?
No.
Not at all.
It's a genetic thing, and if you have gray hair, if you are supposed to get a whiter hair in the future, yes, you will have it.
Yeah.
But on the other side, like me, if you have white hair, if the color of your hair is very close to your skin color,
yeah,
you can make an illusion of density more easy.
Yeah.
The worst thing is black hair, white skin.
It's a big difference.
Yes, because the contrast is increasing, and the illusion of density is also very difficult to get.
Yeah. So can you tell us about your hairline aesthetics? What do you think is a better one for patients? And how do you see yourself like doing? What kind of aesthetic you have?
In terms of design, there is no one hairline design. It depends on patients' expectations, how they willing to have a hairline, according to the graft quality, grafts numbers. You choose a height. If you don't have too much to transplant, you cannot lower the hairline too much. You should begin high and transplant on a certain area. But if you are free, if you have much hair to do, then we can be more relaxed to design it. Yeah. Design depends to the patient, but for all hair transplant patients, there are some rules for hairline design. For example, you should use thinner one-hair grafts on the hairline. Mm-hmm. It should not be a straight line. It should be a broken line. There will be some macro and micro irregularities on hairline. These are gold standard to have a natural hairline. Otherwise, it will look very fake, like a bush. The density is not the most important thing on hairline. Mm-hmm. On the other hand, having some less density on the hairline and increasing the density when you go back is more natural. First 2-3 rows must be a bit sparse. This is natural hairline. Yeah. Not the densest first 2-3 rows.
Yeah. This is why you're using like singles and not triple.
Always singles and twos on the hairline.
Yeah.
And then when you go back for more density, you use 3s, 4s if you have, of course.
Yeah. So we talked about it. But in your opinion, what can help a patient getting a better hair transplant result? Like we talked about Proficia and Rogaine or minoxidil, but what can really help them to get better results?
The standard to have a better result is medications.
Yeah.
Because if you use medications, it makes a real difference. The ones who are using these medications and who are not using, there's a real difference. It's not a must, but it is helpful.
What about PRP
on the other
or IPF
side,
treatments?
PRP, IPRF, of course, not only Propecia, not only Rogaine. These are gold standards, but of course, PRP injection is also very important. Yeah. I always advise monthly injections.
Every month.
But, PRP injections, monthly injections are the ideal way of doing it. But, it's a matter of time, it's a matter of budget. I always say if you cannot have it monthly, then have it every other day. Mm-hmm. If not every 3 months. It's always better than none.
What do you think about people that are some people are afraid of taking Proficia or minoxidil? So will IPRF, PRP is good enough?
It is always better than none. Well, I cannot
You're
say
right.
that PRP is as effective as Propecia, but if you are, this is even, if you're not going to use Propecia, then please have PRP injections, because you should put instead of it to get better results.
Yeah. So
on the other side, doing your homework, taking care of yourself, especially in the first 2 weeks, are very important.
Yeah.
We always say no touch, no rubbing, scratching, playing, checking, no hitting, no trauma. Please avoid heavy sports, especially sports that like football, basketball, boxing. We don't want any touching on top.
Yeah.
People must do their homework very well. If they care themselves, then everything will be perfect.
Yeah.
Actually, patients are the guard of their follicles.
So we don't have a lot of time. So I wanted to ask if you have any other tip or suggestions for people that are interested or already did hair transplant. Just a good one.
The first thing is, I should say, because, they are searching online. And there is an internet knowledge around, and mostly misleading, unfortunately. There are lots of misleading, knowledge around. Yeah. My advice is, please don't try to choose a technique, try to choose an instrument, try to choose a treatment. Please try to choose your doctor. Yeah. You are not choosing the gun. The best thing is choosing the people who is behind the gun.
Yeah, that's correct.
This is my real advice.
It's kind of art,
It's kind of art. It's kind of experience. I don't want to talk about the technician clinics around, things like that. Yeah, you should. The first thing, choose your doctor and trust him.
Yeah, you pay him a lot of money, so you better trust him, right?
This is the best thing, because if you want to choose a technique, for example, why this technique, why that technique, why this instrument, why that instrument, at the end, the doctor will use it, and every doctor has its own technique, and this technique works very well on their hands. This doesn't mean that this one is the best, this one is the worst.
Yeah.
But if you choose a good doctor, he will do his best, and he will have experience to do it. He will have ambition to do it. Then you will get a good result. Nobody is perfect, and nobody is the best doctor around.
There's no such thing as the best doctor in the world. There's no such thing. There's no such thing. So I think we don't have a lot of time. So we need to end this session. But I really want to thank you. Really. Thank you for having...
Likewise, I'm really happy to be with you. I'm really happy to work with Israeli patients as well, because, we are all Mediterranean people.
Yeah.
Warm, always chatting, laughing. To be with Israeli people is fun.
Yeah. You've been here a couple of times, or I saw you here one time, and I'm
maybe
pretty
this
sure
summer
you had
again.
fun. Yeah.
I'm planning to come again.
Yeah, we're hoping to see you again, first of all. And
thanks.
You made this session very interesting. I enjoyed a lot. And there are a lot of viewers here that I'm sure have had a lot of fun and learned a lot. So thank you for having you here. And maybe we'll see you again, It was a good...
Thanks for inviting me again.
Yeah.
It's a very privileged and honored thing for me.
Yeah. So thank you everyone for watching, and thank you, Dr. Ilker. Maybe we'll do another session in the future, but thank you for asking, for joining
Always.
us. And have a good week, I guess. Thank you very much. Thank you very much,
Bye-bye.
guys.
Bye-bye.
Bye-bye.